The opioid crisis, it's one of the most pressing public health issues of our time. But how did it start? And where are we now in dealing with it? Let's break it down with the facts. The opioid crisis didn't happen overnight. It began in the 1990s, when pharmaceutical companies began heavily marketing prescription painkillers like Oxycontin, claiming they were safe and non-addictive. In 1995, Oxycontin hit the market. By 2001, it was responsible for 1/3 of all prescription opioid sales in the U.S. Doctors were prescribing opioids in unprecedented quantities, leading to a rise in opioid use and, unfortunately, opioid abuse. By the early 2000s, the misuse of prescription opioids led to widespread addiction. People who were prescribed painkillers became addicted, and those who couldn't get prescriptions turned to illegal drugs like heroin. In 2018, over 2 million Americans had a prescription opioid use disorder, and around 130 people died every day from opioid overdoses. But the crisis didn't stop there. Enter fentanyl, a synthetic opioid that is 50 to 100 times stronger than morphine. Fentanyl began being mixed with other illegal drugs like heroin and cocaine, often without the user's knowledge. This made overdoses much more likely and much more deadly. In 2020, fentanyl was involved in nearly 60% of all opioid overdose deaths in the U.S. The opioid crisis continues to claim lives today. While there has been some progress, overdose deaths are still at historic highs. In 2022, nearly 109,000 Americans died from drug overdoses, with opioids being involved in over 75% of those deaths. The economic burden of the opioid crisis is estimated to be more than $78 billion annually in the U.S., from healthcare costs to lost productivity. But there's hope. Over the years, there have been significant efforts to combat the crisis. Prescription guidelines for opioids have been tightened. Naloxone, a life-saving opioid overdose reversal drug, has been made more accessible. Many states have implemented harm reduction strategies like needle exchanges and safe consumption sites. More than 2 million doses of naloxone have been distributed in the U.S. since 2014, reversing over 200,000 opioid overdoses. The opioid crisis is far from over, but we're moving in the right direction. It's crucial to raise awareness about safe prescribing practices, encourage addiction recovery, and support harm reduction efforts. If you or someone you know is struggling with opioid addiction, there are resources available. Treatment, support groups, and harm reduction programs can help save lives. The opioid crisis is a complex issue that has had devastating effects on families and communities. But by understanding how it all started, where we are now, and what steps we can move toward solutions. Stay informed, stay safe, and let's keep fighting the opioid epidemic together.